I will share my screen, right?
Yes, Dr.
We
Sabeen.
cannot see anything. Just share your screen.
Yeah, so can you guys see it?
No, Dr. Sabeen.
Oh God.
It's a green
I
button
just-
at the
Yeah,
like in
I
the
did it.
below. Yeah.
So here is share screen. And okay, just a minute. Yeah, I think now.
Yes. Now it's visible.
Okay, so I want volunteers. I want 2 volunteers, please. And can you open your cameras along with me? Volunteers, please. Who are the volunteers to do this station?
I was there. I can present.
Okay, what is your name?
Fatima.
Fatima, can you open your camera?
Yes, ma'am. Yes.
Okay, so I don't know. Fatima, yeah. I cannot see it. Can you
Ma'am, I
see me?
open. Yes,
Yeah.
ma'am, I can see.
Okay, now. Yeah, now. Good. So Fatima, we will begin this session. I have kept the teaching module, and I would like to say all of you, the teaching module is the easiest one to have an opportunity to get the full marks. Okay, it's not much about applied clinical knowledge. It's not much about patient safety. It's all about your communication and your skills of teaching. So that counts most out of other domains. Let's begin. I will show you this station. You will take your 2 minutes. Then you will perform this station as a whole. And then we will discuss. Okay?
Okay.
Yeah. So this is the
Sabine,
station.
I think you have Sabine, you have background noise, or Fatima, you have background noise. Somebody has background noise.
Ma'am, I have background noise. This is my... Sorry.
Okay. So your 2 minutes starts now.
Okay. ma'am.
Stop your background noise.
Fatima, you have not background noise. There is any TV or radio, something is on
Yeah, you need to
on the
stop
back
it.
of you.
Ma'am, now?
Yeah, now better. Okay.
Yeah.
Okay. Ma'am, where is the diagram?
Sorry?
Where is the diagram?
No, there is no diagram. There is diagram, but yeah, I will show you like this. This is just a common diagram.
Okay.
So I will tell you, wait, time. Yeah, only 30 seconds, then we will start.
Okay.
Okay, your time is up. Now I will start the timer for 10 minutes. Let's begin.
Okay. Hello, I'm Fatima, and you are?
I'm Jack.
Okay, how are you, Jack?
I'm okay.
Okay, so I can see that you are here today to learn about the POPQ examination. So is that all, Jack, or you want to learn something else?
No, actually, I was there in Eurogyne clinic yesterday, and they were examining patients with prolapse, and they were, it's although I know about it all, like grid and making classification, but I'm not very very good at examining and then putting over the grid. So I just want to know how to do the POPQ examination and then assess the degree.
Okay, sure. Today we will learn about to classify. I will tell you about how we what is this important and how we classify the prolapse according to the this classification. So before going on a discussion, Jack, I just want to ask, how are you doing in the department? Things are good? Are you enjoying working here?
Yeah. I'm recently, I have joined now around 2 months, and I'm doing well, and I'm doing my clinics and calls and everything. So it's going well.
Yeah, perfect. So, may I know, do you have any idea about
Yeah, I think it is to
yeah,
quantify
perfect.
we do it. Yeah.
Yeah. So
Yeah.
perfect, Jack. Your knowledge is quite good. So the basically POPQ examination is, it is a objective quantification of pelvic organ prolapse, and it is recognized worldwide. Okay. So this is so the its importance is that there is no subjective variation, and it is recognized on all forms, and sometimes we use it for the as a follow-up. If we do we are doing surgery, then before surgery we are doing the POPQ classification, and after this, if patient is having some complication, then we can do it again, and then we can compare the results. I mean, clear.
Yeah.
Yeah. So then there is a classification of the prolapse. So basically it has 4 grades: the 0, grade 1, grade 2, grade 3, and grade 4. So as you can see that this is a grade. Okay. So here is the upper column, the middle column, and the lower column. So in the upper column, the point A, B, and C. So the point A and AB are the points which we measure on the interior vaginal wall. Okay. So and in the
Okay.
Jack, in the POPQ, the reference point is our hymen. Okay, we take it as a 0. Am I clear so far?
Yeah, but will you show me on there is this mannequin, like I used to, I don't know how to measure. Yeah,
I can show you there. This look, you can see here. This is the upper. You can see that here is the point. There is anterior vaginal wall. There is a posterior vaginal wall. Okay, then there is a cervix, and D is the pouch of Douglas. I'm just showing, telling you the idea, and then I will show that how we grade and how we measure these points. GH,
Yeah, that's
GH
good.
is for the genital hiatus, and PB is the perineal boundary. Okay, and the TBL is the total vaginal length. So here it is a hymen. Is a, you can see this is a hymen, and it is we take it as a reference point, and this is a 0 point. So when we do, so when we measure the anterior points, that is AA and BA, we take the external uterine matrix as a reference point. Okay. So the AA point is 3 centimeter proximal to the external uterine matrix. Am I clear so far? Okay. Yeah.
Okay. 3 centimeter above.
And BA is the remaining point on the anterior vaginal wall. After measuring AA, it is a most distal point, and the C is the cervix. So Jack, before measuring this POPQ classification, there are some prerequisites we should follow. Okay.
Mhm.
So the patient, the bladder should be empty. Okay. So we should explain the procedure to the patient. We should need a ruler. Okay. So it should be, there should be the centimeter grids on that ruler. We need a same speculum, and sometimes we need as
Mhm.
a sponge holder or Valsalem to retract the interior posterior vaginal wall or the uterus. Am I clear so far? Yeah,
Okay.
can you repeat
Mm.
what we should need?
Yeah, like bladder should be emptied, and
Mm.
we should use Sims speculum.
Yeah,
And
exactly.
yeah, and what about the patient position?
Yeah, so we can do it we measure when the prolapse is on its maximum extent outside. Okay, so then the patient position can be like, we can do it in the left lateral position, we can do it in the Sims position. Okay,
Okay. Mhm.
so and then we measure these points.
Okay.
So the interior part is measuring the interior half of the pelvis, like the bladder. When we are measuring, we are looking for the cystocele, then this A, B, these points are important. They will tell us that how much the bladder is coming down.
Okay.
Okay, so the middle points are GH, that is the genital hiatus, that is measuring from the midpoint of external urethral meatus to the posterior fascia.
Okay.
Okay,
Okay.
yeah.
Mhm.
And then pubic perineal body, that is measured from the posterior fascia to the external anal opening, and then TBL. So normally there are measurements like when there is no prolapse, all the measurements should be in
Okay.
the minus, reading. And when there is a prolapse, we measure them as a plus. Okay.
Mhm.
So normally in the first in the anteriorly, A will be -3. Okay.
Mhm.
B will be almost like you can see if that it can be -6 or -7, and C is the -C as well. Sorry, C is the distal point of the cervix.
Okay.
Okay, so it should be around total. It should be 2 minus total vaginal length, and total vaginal length is usually 8 to 10 centimeters.
Mhm. Okay.
So I'm telling you the normal
Mm.
measurements. And the perineal body should be 3.5 to 4.5 centimeter, and genital hiatus is around 2.5 to 3 centimeter. These are the normal measurements.
Okay. So what will I do, like after measuring? I will put them here in this.
Yeah, we will put in the grid the things, and then I will explain. And then the lower one part is about the
Mm.
posterior vaginal wall. When there is a rectocele or enterocele, we measure. TB is on the posterior, like 3 centimeter from the genital hiatus, -3 centimeter. And TB is on the most distal part on the posterior vaginal wall. So D is the pouch of
Okay.
pelvis.
So, so is it the
Okay.
only way to do this? Is really complicated. Is it the
Yeah.
only way to do, like why we have to do this grid all measurements, and there is any other way to quantify the
Yeah, there are
staging?
few other classifications like Beecham. Beecham, there is a classification that we call that the Beecham, in which there is a simple grade like grade 1, grade 2, and grade 3. And there is another classification. But I will come back to you. There is another classification. These are the simple classification, but they are not much accurate as this Fabio classification. This is the point that this is accepted worldwide, like by a urogynecologist or gynecologist, to see that how much is prolapse. If you are doing classification and you are telling someone that this patient has this Fabio classification, he will understand ultimately that, okay, this is the point.
Okay.
So yeah, this grid is looking little bit complex, but I can show you in a more simple way. So like normally
Coming towards the other slide, and then with that, I will give you feedback as well. So, okay, so I will ask you first a question. In a teaching module, when you will get a scenario, what will be your aim before going into cubicle? What you would like to, like most important in
So, ma'am, most important in my mind is like what the junior wants from me. What is like his or her agenda?
Need juniors need her meds.
Yeah.
Okay.
Yeah,
So look,
exactly.
and focus on the task.
Yeah.
Now, PopQ is a big topic. You cannot teach whole topic. So just stick to the focus on the task. Like you have to just tell what is PopQ that you did, importance you missed, and then I prompt you, and then in the end you said me importance also. Then explain the classification. So try to go to the classification point, like 0 stage, but just try to pass the grid and then show a little bit like stage 0, when we will call it stage 0, what is stage 1. So that would be complete your task, because in your task, the second question was explain the classification. Okay, after explaining her grid. Okay, now these are some salient points in teaching. Are you there, Fatma? Hello? Hello? So,
can you
am
hear
I
me?
audible? Yeah, am I audible to all?
Yeah, yes, ma'am. Sorry, my son was
Okay.
crying, so I can
Okay, no problem. These are important teaching points, and then I will come towards the feedback. See, so build in the rapport with colleagues. You introduce yourself, you ask my question, you ask me about what is my what I would like to know. This is you also asked, what do you want to learn? And I told you, identify ask me. You you asked me what do you know already. This is very important question before going into detail about do you know already about the PopQ and what do you want to learn, because you need to fill the gap only. Okay, so that's also you asked, and I told you a little bit I know and all that. Set the agenda. You did not set an agenda. It's very important. In agenda setting, few points will come like, okay, now I will be discussing with you about the teaching, about the skill, how we will do the PopQ and how we will quantify it, and then we will discuss the classification also. Okay, I will also provide you some resources like strategy videos, like PopQ guidelines. From there you can have more knowledge.
Yes, ma'am.
And then you can come back to anything whenever you feel any doubts. Okay, thirdly, you should tell her that I will ask your feedback about today's session, and I will give you my feedback as well. These points are very important, Fatma. Try to set an agenda before going to, because in the end there is no point. You will miss you will miss giving her strategy videos, you will miss giving her resources. So finish it in the beginning. Make the sequence like this. Okay, set the agenda. So it was missing in your consultation. Then teach the skill you tried. Teaching always, landmarks are very important. You talked about hymen, you talked about anterior vaginal wall. I showed you the picture, so that part you did. Hands-on, you said, yeah, you say about, or let's do on this mannequin. You show me how you will measure. Okay, so these anatomical landmarks and hands-on are very important to say. Bring in teaching station. Every teaching station, there will be some landmarks. So you need to talk about. Then in the end, you could have asked me that how was the session? Now you know something. Like, did you get what you want? So like this, in the end, always make a closure. So is there anything which you want to learn more? We can have further sessions, and you can come back to me. You should, you know what, now it's very beginning. You should do under supervision. Always whenever you will be in the urogyne clinic, you should be with the, you should do these measurements under supervision, and then you will be able to perform yourself. Okay. And if you have any difficulty, you can come to me. Okay. Okay. Then the feedback. Yeah, this is welcome. The follow-up is also done. Summarize in the end to confirm understanding. Yeah, so this is also done. Now the next, these are points, and you discussed. It was like done. Okay, now coming towards the Do you have any question for me now? Actually, feedback is done. I told you what you missed and what you did.
Yes, ma'am.
So some points are important related to safety. Let it start that whenever we will examine, this is the mannequin, but of course you will be with the patient. So it is very important to consent. Okay, this will be a face-to-face examination. There will be a chaperone. So we talk these points also. They will enter your patient safety domain. So tell candidate that whenever teach something with the patient, please explain them about the taking consent, about chaperone. Okay, so start like this. That okay, now this is the mannequin. This is the picture. Whatever is there available to you, you will say about that. And this is here. So I will teach you about this. And if there is a patient, you will always take consent. You will always ask patient about indications for examination. Any active ulcer, any active infection. So just rule out that and then do. Okay. You will also talk about the equipment for this examination, because this is an examination. Okay. We talk about what equipment we will need. See, this is the same speculum. This is the Cusco's speculum. So these instruments we will use. If there will be some infection or something, then we will take a swab. So we do have those measures also available. Then you will talk about position. So go in sequence, like start from the sequence. Then we will go about the position. Okay, so this will be the position. Now POPQ importance, you told already, that was okay. So POPQ is an objective standard. We made the POPQ because it is a worldwide standard. Pelvic organ prolapse is a variable. A patient cannot, it's not decided on the subjective appearance, but the objective demonstration is very important. That is why this is the best evidence to proof quantification which we do. With the very minor inter-observer and intra-observer errors. So you will say like that, okay? Then importance, you will say importance, that why we do POPQ. I asked you that why we will do this. We can do simply like without this. Then you said, no, it is very important to do it, because why it is important? Because we need to assess the surgical and conservative management. After this POPQ quantification and classifying the stage, we will be able to decide surgical management for this patient, okay? Okay, Fatima?
Yes, ma'am. Okay. Okay. Yes.
You will say, explain the significance like this. Okay. Then come now. This is introductory part, and this will be very for take few seconds in this, less than half minute. Then come to the your task. Your task is teach the POPQ. Then you have done this job. You have to explain the grid. You have to show the anatomical landmarks. Hymen will be the fixed part, and we will take the hymen as a standard, and then we will classify. So this is the anterior vaginal wall. This is you can say this. She is ST2 or she is ST1. So you must be knowing about the anterior vaginal wall. Okay, then you can go ahead with the and you can teach her that this is the point, anterior wall 2 points, posterior wall 2 points. We will take it in the minus readings above the hymen, and we will take positives below the hymen. If there is no visible, one thing is important. In the beginning, you will tell her that all examination we will do with the Valsalva maneuver, okay? Except total vaginal length, because total vaginal length is a variable indicator. It cannot be done under Valsalva. So once you will do your all measures with the Valsalva, how you will do Valsalva, do you know about that? Just ask the question to candidate and then answer yourself. Don't expect that candidate will answer you. The trainee will answer you. Just ask questions. This will make you gain marks. Just ask her, do you know what is, how you will ask her to Valsalva? So she will say something before that. Tell her that, okay, I will tell you how to do that, and we will ask patient to have full strain. So when the all prolapse will be out, she will be in the restraining. This is the Valsalva maneuver, and then we will start measuring. This is the measuring tape will be there. This is the measuring tape. This is how we will put. Show your hands. In the teaching, you need to show your hands. Okay, this is very important. This is teaching. So show your hands. This is how we will take the measuring tape. This is how we will keep it here for the prolapse. This is the anterior vaginal wall. This is how we will retract the anterior vaginal wall up. This is how we will retract the posterior vaginal wall. Then we will put the measuring tape below for the posterior vaginal wall measurement. And this is how we will do. So be active, use your hands, use mannequins, be interactive. This is the teaching. There is nothing to do with applied clinical knowledge, nothing. Just bring the patient safety points, and then you will be done. And the teaching is very easy. Okay. After that, quickly go with these measurements and then tell him that this is the grade. Once you will measure by doing this, are you getting with me? Do you want something more? I will do it in front of me. Can you able to measure this? How you will able? And then he will show you, yeah, this is how I will measure and all that. Okay. Then all measurements, whatever we will get, we will put over this grid. Say in between that it is very difficult to complete this topic at the moment, Jack. I would love if we will have further sessions to, to further deal with this grade and further understand. But at the moment, I will brief you out that all measurements we will put here, and then we will calculate them according to, this is the -3 always is the normal. At -3 centimeter, the stage is like, maybe it's no prolapse, but if it is prolapse, then it is above the hymen, it will be stage 1, and then at the below the hymen, it will be stage 2. So once we will put the measurements here, then we will calculate them, and then we will be able to assess the staging, that is from 0 to 4. So 0 when all structures will be in their place, and hymen is the 0, and there is no prolapse. But 1, we will take the minus measurements and plus measurements. So above the hymen, above the -1 centimeter, it will be stage 1, and between -1 and +1, it will be stage 2. So this is how something you will describe. Don't go in too much depth. Just once you will be able to explain him grid. I think this is the teaching the POPQ, and then little bit you will talk about the classification, and then go ahead and then ask. Don't forget these points. How was the session? Is there anything which is not cleared? Do you want me to repeat anything? These questions are very important. Don't forget these points. So take some time in the end to ask these questions. That do you want me anything to explain you in repeat?
Yes, ma'am. Yes, ma'am.
Yeah,
I
so
totally.
did you get it?
Yeah, ma'am. Sorry, actually.
No, it's okay. It's okay. You did very well,
But-
but some few points which I have done. So this is to be added in your points. Okay. Now
Sorry,
I need
ma'am.
a
My son-
second volunteer.
Yeah, my son was crying upstairs and it was
No, it's
making me.
okay. But still you have done a great job. Yeah, it was a difficult station.
Thank you.
Okay,
Yes,
now
Dr.
the
Fatma.
second volunteer, because now there is no station. Yeah, there is no station. We will discuss like some points related to the
For
pedagogical
Dr.
labs.
Fatma, Dr. Sabine, I want to add one point that
Yeah.
that yes, it was very well performed, Dr. Fatma. But one thing I want to add is when you ask the trainee or colleague a question, right? And whatever he or she answers, always appreciate. You just said okay.
Yeah.
Okay.
Always appreciate that it's very good, very nice, you're very intelligent or whatever, just appreciate few words and then go ahead. And make
Yeah.
it two-way communication. I was looking at your presentation that the two-way communication was somewhere missing. So make it, more interactive. At least twice you
Okay,
need
ma'am.
to ask the questions. So that will
Okay.
be, yeah, because this is our teaching
And
station requires all these
one
basic,
more
basic-
thing,
yes.
Fatma.
Yes, ma'am.
Yes, Zubia, continue, then I will comment on it.
No, that's all, Dr. Amreen. Just I want to add this point, a very minor thing, but this is very important for the teaching module that we need to appreciate and the session.
Yeah, we should
interactive.
appreciate. Yeah.
Yes. Okay, Dr. Amreen, you can continue.
Yes. Yeah. And Fatma, it's well done. You were not looking confused because this station was really very confusing and very difficult. So you have done good job. There are certain points in the teaching already. Sabine and Zubia, they have mentioned to all the things. Just whenever you are doing the teaching, you will just keep in your mind the template, what you need to talk inside.
Yes, ma'am.
Forget about the station, that whatever the task is given to you, that is really it is a requirement, and it comes only in your applied clinical knowledge. But in teaching, what they want to see you actually, they want to see that how you communicate with your colleague. So whenever you will enter in the station, if it is really a bullying station or something, okay, no need to smile or something like that. But if it is a teaching station and you got to know it, that it is teaching, then please keep a smile on your face. This is also comes in your communication, as Dr. Sabine told. Use your hands and
Yeah, ma'am.
involve the and by asking the question. Because they are role players, so they don't know the answer. So what you need to do is, as you mentioned initially, that there is a grade 1, 2, and 3. And then pause and then ask, could you please tell how many grades? You already answered. And then you will ask them, then he will tell 2 or 3, then you will just appreciate, as Zubia told. 3 questions is important. So what you need to do, your introduction, you did very good introduction, then keep smile on your face. Then you ask about bullying point, since how long they
Okay.
are inside. And then you need to ask that how much knowledge they have on that, and then provide some information. Just tell them, reassure them that I'm going to tell you all about this thing, but I'm also going to give you some information in the form of links or any literature in the end, so that you can also go through that one. Then you start your thing. In between, always count in your finger if you are in anxiety, that I have asked 1 question, 2 and 3. 3 questions are most important that you need to ask. If you are not interrupting the candidate, so you will not pass the teaching
Okay, ma'am.
session. Then in the end, the feedback, and then keep tell him or her that if you need, I am always available here. You can anytime catch me up, and we can sit again and we can discuss this thing. Okay? And then say thank you on with your smile and just left the room.
Okay, ma'am.
Okay?
Thank
Good
you.
luck.
Thank you so much, ma'am. Thank you so much for your guidance.
Okay,
So we
so
continue.
can I have a second volunteer? We will just have this. It will not be a full performance, but I will ask few questions related to these scenarios, and then we will discuss. We all can discuss. So who is the one who will talk to me? There were named Zahra and Roma. Come forward.
If
Is
no
there
one
any-
do, then I will perform. Rekha.
Okay. Arika?
Rekha.
Rekha.
Rekha. Yeah, Rekha. Okay, let's do. Okay, Rekha. So pelvic organ prolapse, if we will take it as a topic, we did teaching. So what is in your mind? What can be other modules related to this? Here I have written some possibilities, like in urogyne, it can come as a pelvic organ prolapse. It will be a simulated task. Patient will be sitting with you and she will have a prolapse. She will have some comorbidities. This is very favorite exam question. It has come many as a recall. So she will have a comorbidities and she will be with you. So just show me your introduction part, Rekha. Just don't go beyond the introduction, and I will see you that how you will perform it. Yeah, let's begin. I'm the patient. I will tell you whatever you will ask me, but it is only introduction. Okay, don't go into information gathering.
Okay. Hello,
Start.
I'm Dr. Hello, I'm Dr. Rekha in the Urogyne clinic. May I confirm your name and age, please?
Yeah, I am Lisa, and my age is 62.
Okay. Is it okay if I call you Lisa?
Sure.
Lisa, how are you doing today?
I'm not good. That's why I'm here.
I'm really sorry. Don't worry. Me and my team are here to help and support you. I can see that you have lump down below and you are here to discuss the further management. Is that right?
Yes, doctor.
Any other concerns and expectations from today's consultation?
Yes, I am really fed up of this lump. It's been for like 1 year now, and I really want to have a surgery. My physician told me that you cannot have a surgery, and that's the reason I'm here with you. So I really want an operation as soon as possible.
Okay, I completely understand your concerns, and every woman has a right to take their decision. I will discuss with you the pros and the cons of each option so that you can make the informed decision for yourself. Is that okay for you?
Okay, perfect. Okay, done. That's it. Good. So only missing point in this introduction, you had an empathy. You introduce your part. You asked me my concerns. You asked me expectation. That was very good. You said, I am sorry, and we will be supporting to you. So don't bring I am sorry here. You don't know anything at the moment. When I showed you, when I told you, yes, I'm not happy, tell her that, yes, Lisa, I'm here to ask you few questions to know you better, and whatever your concerns, we will discuss, and I will try
Okay.
my to deal with
Okay.
you to resolve your concerns. Okay, don't say I'm
Okay.
sorry. It's not your
Okay,
fault.
because she said that
Somebody-
I'm unhappy. That's
yeah, other
yeah. Okay,
entities
I
sentences
get your
like
point.
yeah, it's really tough time for you, or it's difficult. But we will discuss further. I will be asking you a few questions, and then we will make a plan.
Okay, fine.
Okay, now let's go. Let's do this little bit. I'm giving you only 2 minutes, and you will ask me the relevant information gathering. Okay, only 2 minutes. Wait, let me put the timer on, and then you will do it. So just in 2 minutes, ask me whatever you can. I'm 60, you know it. Don't ask any irrelevant question. Try to do that. Okay, start.
Can you tell me more about your lump?
Oh yeah, doctor, it's been for 1 year, and it's really bothering now. I think that it's coming more, and before I used to take it in, I used to reduce it, but now it's not. I'm really bothered about it.
I'm really sorry for that. What makes it better and worsen your situation?
Just when I lay down, I feel it's better. Otherwise, nothing. I
Any
cannot,
heaviness,
no, I cannot
backache?
exercise. Yeah, I cannot go up and down stairs, and I feel it's coming out.
Is it affecting your way you live?
Oh yeah, really. It's embarrassing all the time.
I'm really sorry for that. Don't worry, me and my team are here to help and support you. Any backache or bleeding?
No,
Any vaginal discharge?
no.
Any problems with waterworks and bowel?
Sometimes I feel that I leak at times. Yeah.
Any other associated symptoms have you noticed?
Like what?
Like frequency and the going to the toilet?
No,
No. Okay. Any difficulty in passing the urine?
no.
Sorry to ask some personal questions. Is it affecting your sexual life?
Yes, I need to reduce it. It's painful.
Have you tried any treatment so far?
Yes, my doctor has given me Passeri.
Okay. Is it beneficial for you or not?
No, I just tried it for 2 weeks, and it's really uncomfortable. I don't want that.
Okay.
Okay, done.
Okay,
Your
we'll
2
just-
minutes is over. Sorry, Rekha. I just stopped you here. It could be 3 minutes, but now, tell me yourself, did you miss what important points you missed? You asked relevant questions. There was nothing relevant, but I just want
But
to
still, the other points are remaining, which I have to ask, but the time is limited.
tell me what points. I will note down.
Okay. First of all, I will ask about
Cardiovascular. Now start your information sharing. I want to see your information sharing, how you signpost and how you go ahead. Now it is in your mind. What is in your mind? What is the plan of me?
I don't understand what you mentioned.
Like
Please
what
repeat.
is in your plan? What plan you will discuss with me?
Yes, comorbids, can you repeat? One mention
Like
COPD and what other?
I have high blood pressure, I have sleep apnea, and I
Okay.
have
What's your
diabetes.
BMI?
Yeah,
Okay.
BMI is 30.
30. Okay, fine. So,
I told you 2 weeks.
yeah,
2 weeks, just 2 weeks.
2 weeks. Okay, fine.
Complete
I will start. Okay, yeah.
Okay, start.
Coming to the management, your management will be by the sheer team, including my consultant and also the specialist nurse and the physiotherapist and the dietitians and patients. So we all will be taking care of you. The options are available in the form of the new treatment, exercises, lifestyle modification, pastry, and the surgery. Are you with me so far?
Yes.
I can see that you already tried the exercises and pastry. So may I know that are you doing the exercises under the supervision?
No, I tried it for some time, not
Mhm.
under supervision, and I feel that it's just little walk I can do, no more than that.
Okay, I completely understand. So what we can do for you, we will arrange the exercise program for you, which you can do properly, and also the dietitian will guide you about the diet plan. And may I know that also the exercises will be under the supervision of the physiotherapist, and they will be further improve your condition. Okay.
Okay, doctor, but what improved the condition? It is all out. I need to take it out.
Mhm.
What exercise I
Mhm.
do?
Yes, of course, exercise alone will not do. Along with this, we have to do the other measures also. Okay.
Okay.
And also, as I can see that you have some comorbids that we have to optimize before you're going ahead with the surgery. As I can see that you are looking forward for the surgery. Yes, surgery is a very good option. It can deal with both of your. We will during the surgery, what we can do for you. Let me draw a picture for you. During this surgery, it will be done by putting you asleep. Anesthetic doctor will going to talk to you, and we will put the your womb and the whole of your pod that comes out back into its place. Okay, so by doing this, it will support your walls, and you will continue with your daily activities. Are you with me so far?
Okay. Yeah.
But I can see that there are the certain factors which can reduce the success rate of the surgery. So, what do you think? If you allow me, I will discuss it with you. Then, the end, you will take the decision for yourself.
Okay. Yeah. What will be the options other than surgery?
Okay, I can see that you have tried the pastry for the 2 weeks. May I know the reason that why you stopped taking the pastry?
Because I didn't like. I heard that it's a foreign body. It will give me infection.
Okay. Yes, you are right. But what we can do if we if we replace the pastry every 6 months, and also my nurse guide you how to take care of the pastry to reduce the risk of the infection associated with this. Because so many women who take the pastry to fit for the surgery. Their symptoms get improved because it's the small plastic-like device made up of the rubber and plastic. We will put it inside the vagina to support the vaginal walls. Are you with me so far?
Okay. So it will not give an infection.
Yes, there is a possibility of the infection, but we can reduce this by taking care of the pastry. We will wash it, we will replace it back, and also we will guide you how to take care of that.
Yeah, but I want a definitive, I want operation. I know if I will, if
Mm.
pessary will not work, I'm not happy about pessary. Why are you
Yes,
convincing me for pessary?
yes, it's your decision. But if we go ahead with the surgery, then the success rate will be reduced. There will be the increased chances of the complication. As I can see that you have the hypertension, also your weight to height ratio is on the higher side. It increases the risk of the clots in the legs and the lungs, and also anesthesia complication will be more, and the chances of the coming back of the lump will be more. So to improve the success rate, meanwhile, what you think that we will try these measures, and once you will fit for the surgery, we'll go ahead with that.
Okay, thank you. Yes. So you did it in 4 minutes. It's okay. So you did it in 4 minutes, and it was okay. This is how you need to convince her. And you signposted well. You said me that there are options, exercises, pessary. And this lady in the beginning, if she would have told you that I don't like exercises, or then don't go too much in the exercise, like supervised exercises, and
Okay, fine. Okay.
her management at the moment is pessary being comorbid. So you told them that I'll try these pessaries. Just try to, reassure her that it will not give you an infection. And, it is one of the successful management. Don't say that surgery will reduce the success. success rate, and then she will say that, yeah, I heard that many people they are doing surgeries for the prolapse and they are good. So what are you talking about the success? Don't say like this. Say that these are the options. As you have, they will not give you a healthy patient. That's the reason they have
Comorbid, yeah.
giving the comorbidity. So you will tell her that, see, at the moment you have your blood pressure is not under control, you have uncontrolled blood sugar levels, you have sleep problems, so it will be difficult in anesthesia. So what I feel that and you have not tried PESRI so well, and PESRI is really reassuring. It will not give you an infection, because you will be under follow-up with us, right? A nurse can manage your PESRI. She can visit you home if any problem, anyone is not here. You don't need to come frequent time to hospital for this. Try PESRI for some time. In the meantime, do communicate with colleagues here. Now I will write a letter to your GP. I will write a letter to your to the physicians, and then once they are okay for your condition, once anesthesia doctor give us a green signal, then so then we will decide for the surgery. I will also connect you with my consultant gynecologist who will be doing surgery. So like this, okay? Otherwise,
But
you have
Dr. Sabeen, we can say that I'm sorry to interrupt you. We can I mean to say that with the PESRI there is a small risk of the infection. Of course, if we can there is a small possibility that infection can happen, but after taking care of the PESRI can reduce this risk.
Yeah, that is ulceration and little bit. So you can tell her that benefits are more. You can bring this sentence, Rekha, that there is they see, and nothing is 100%. So at this point, tell her that Anisa, we always choose the option, and we always weigh the risk and benefit. This option carries more benefits for you at the moment. Okay. If based on your uncontrolled medical and surgical situation, we will do surgery at this time. This surgery will not be giving us a real success. So how if we will wait for some time? In the meantime, you will have this, you will have this, and then we have PESRI. You will follow up. You will come to us, and then we will plan surgery. Okay, be like this. Be diplomatic. Also, she will be happy in the end. She will tell you that yes, I'm going to have a PESRI. Okay. So this is done. Now the other station, it can come as a structured discussion also. So the examiner will ask you several questions, and then you will answer those questions according to the, always try to answer in the structured discussion, always try to answer with the significance of the situation. Don't forget, the structured discussion will come, they will give you a scenario, definitely. There will be a scenario outside, and then inside there will be questions. So while you answer the question, don't forget the scenario, please. This is to all of you. What we do in the structured discussion, we start from our part 2 knowledge, and we start answering like that. You have to answer with that, and the patient was given outside. So keep in mind what is there in the scenario, and then answer accordingly. Okay, this patient has comorbid. This is the so I'm thinking that this is the correct management for her, like this. Okay. Another possibilities could be core surgical module. So core surgical is you little bit add this core surgical in your information sharing. That was not needed. Surgery, you talked up something about the surgery. We will numb you up. We will give you anesthesia. This is all core surgery. Don't discuss that here. Here she is sitting for the management options. Don't go beyond. Don't go inside that management. You are here to discuss.
Just superficial, we have to say. Okay, fine.
For the core surgical skill, when there comes a vaginal hysterectomy or something like that, then you talk everything about the surgery, like what is surgery, what is pre-surgery, what is the pre-operative assessment, and what during the surgery, is she fit for the surgery, and how long it will be. She will ask you, okay, I need to go home early, I don't have anyone at home, I'm alone. So all these points in the core surgical skills will come. Okay,
Dr. Sabeen.
So this is all for today. Now, if anyone has any question. Thank you, Rekha, and thank you, Fatima. You did.
Thank you so much, ma'am, for your guidance. It was really great session.
Okay, thank you. So any question?
No, ma'am. Thank you so much.
No, ma'am.
For giving me the chance.
Okay, thank you.
Thank you.
Thank you all of you for joining this session. I just want to announce that we are starting our long course from the next month. So whoever is interested, please contact our team, MRCOG OSCE Prep team. So we are here for you, and we will start from the next month. This will be the 4-month long course for the May candidates. So you are most welcome. Whoever wants to start with us, so they can contact any of our team members. Okay, thank you. Thank you for
Okay, ma'am.
joining.
By
Okay, ma'am.
adding Zubia, yeah, by adding Zubia, whoever is taking the long course, we are also giving always the offer for the mini mock. So they are, this is the long course plus the one mini mock they are doing with us. And we are also doing 2 talk article session also with them. And we are also planning in the April, if we have the enough candidate, then we will arrange face to face this mock exam circuit in Lahore, Pakistan. So if we have more candidates, then we will arrange that one also. So thank you so much
Okay,
for
ma'am.
all of you joining. Keep it up. There are small points. All of you, the knowledge, all of you know
Dr.
how to
Amreen,
do.
I want to ask one question. Dr. Amreen,
Yeah.
in my exam, last time exam in November, there was a teaching station. Initially, the colleague was very happy and he's saying there was no, I think there was no bullying. He's smiling, everything he was doing. But when I finished the session, again he was asking the same question, the post-operative management, bridging, Thamawal. So is there any something bullying is there? I don't understand this. So
No, Rekha, if you are feeling that, there is something else, you can ask frankly during the session that I can see that you are looking little bit nervous. Is there anything bothering you? You can, there is nothing should be bother you on your workplace or any other place out of the workplace. If there is anything, you are most welcome. You can discuss with me. If any ways I can help you, I would like to help you in that case. You just ask open question, so that
but Dr. Amreen, he
if
was very happy. He was giving the answers happily, and but one question I addressed that 2 to 3 times, but again he was asking same. I don't know why he is asking
maybe
again and again.
maybe Rekha, you need to rephrase your answer. Maybe he wants or she wants you to rephrase your answer. Maybe they want to listen
Something else he
something
wants
else.
to listen. Okay,
Yeah,
maybe.
maybe he want to listen something else and you are not coming to that point. And
I mean, he
that is
did
the
the
thing.
same with another my colleague also, like who has the exam on the 6th of the
Yeah.
November.
No, for the
So,
bullying, if you are feeling that this is bullying station, or you have some gut feeling, we have some gut feeling during the exam, so you can ask openly that I can see that you are upset and you are not with me little bit, so I can ask, is there anything bothering around you? You can ask like that. If you think no, absolutely fine, this one sentence is more than enough to you to rule out for the bullying. And then come to that point that maybe I am missing something that he wants to bring me for that point, and you are missing that one.
Excuse me, Rekha, there's only,
yes, ma'am.
There's a buzzword when you a trainee that I will keep your issues confidential and it will remain with you and me, then they will open. If you won't utter the word confidentiality, they will not speak. So don't miss those buzzwords. Very much important because RCOG proper key for each task. And they are supposed to talk about those keys. According to those keys, if you won't utter those words, your there will go on bothering you, even if the domestic violence, even if it's anything STI, you have like for the gynae, you have to say the quality of safety for the sexual. Similarly, for bullying and you have to assure your trainee whatever he or she is saying to you, that will remain confidential. You are going to seek out the solution for that, and you're not going to speak it to anyone else unless. So this is the thing you should ask.
When we are asking the bullying questions initially in the introduction part, he was very happy and he was giving the answers like the other colleagues are giving. But one thing which I feel in this station, he was happily giving the answers in initially part in the introduction. He was very happy. He's saying everyone is supporting me. I did not find out any bullying in the initial part. So, but again, maybe I think 2 to 3 times he asked again, what's the post-operative bridging? But I don't know. Maybe I was not
Did you-
getting the answer. Maybe could be
This
the
means
reason.
that bullying and undermining, it should be, in the teaching templates. When you're teaching your
Yes.
training, there are certain things which you have to utter
Huh.
3-4 words, like how is everything going on, how is your colleagues'
Yeah.
behavior, which is bothering you. Do you think, do you have experienced any sort of bullying, undermining in the at your working station? Is there anything which you want to share with me? I assure you that will remain confidential. That is the only thing which, these are the 2 words. Just from the start of teaching task, say those words and then start your teaching, because these are the things where they will stop if they know that because they are given the key, they have been given the words by the RCOG. If you are not going to utter those words, they will go on bothering you again and again and again.
Yeah.
Okay, ma'am. Maybe could be the reason. Okay. Thank you so much,
Yeah,
Dr.
it could
Uma.
be the reason, Rekha. Yeah, that maybe he wants to listen something else when you
Something
are
else
giving
also.
him.
Yeah.
So
Yeah.
you are
Maybe.
not coming to that point. That is only,
Yeah.
even
That's
it
maybe
can
reason.
happen to your role play. Yeah, even it can happen to your role play. I was discussing with my other candidates and yesterday, and they were saying the same thing on the role play. So then we realized that they want to listen she wants to listen
Something
something
else.
else, but she was not giving the answer properly.
Maybe the reason.
So,
Yeah.
yeah.
Thank you, doctor. Thank
Okay,
you so
So
much.
thank you.
good luck, Rekha, and all of you.
Sabine,
It was a nice
can you
session. I hope
end
you
the
people
meeting
enjoyed it.
because you are the host. You can end the meeting now.
Yeah. So without you people, we cannot complete our session, and it cannot become successful. So thank you so much for all of you.
Thank
Keep
you,
on.
ma'am. Thank you, ma'am.
Yeah.